Around 10 weeks of pregnancy, most parents are offered a blood test called NIPT. It's one of the most useful tests in pregnancy, but actually one of the least well explained. So by the end of this video, I'm going to explain to you exactly what PT is, what it can't do, and ultimately whether the test is right for you. I'm Martin Maher, I'm a fetal medicine consultant, and I talk to patients about NIPT day in, day out. And what I often find is that patients come to me either with not enough information or slightly incorrect information. So this one's for anybody out there who's been offered an NIPT and they're not quite sure what they're saying yes or no to. And if you find these videos helpful, then please hit subscribe. Okay, let's go. NIPT stands for Non-Invasive Prenatal Testing. And the clue's in the title, so it's non-invasive. So that means that we take a simple blood test from mum to give us some information about baby, and nothing goes near your baby at all. So here's what NIPT is actually doing. When you're pregnant, fragments of baby's DNA circulate around mum's bloodstream alongside her own DNA. NIPT basically takes these strands of DNA and basically tells us whether there's the correct number of chromosomes. And chromosomes are bundles of genetic information that are stored in each and every cell of your baby's body. Now, the test can actually be done from 10 weeks of pregnancy. That's much earlier than a lot of other important tests that you get in pregnancy, which really what makes the test so useful. And one thing to say up front is that NIPT is a screening test. It is not a diagnostic test. And that distinction really matters, and I'll come back to that a little bit later. The important thing is it will give you a probability of baby being affected by a range of chromosome problems that you have tested. It's not a definitive answer. So what is NIPT actually looking for? It tests for 3 specific chromosome conditions: Down syndrome, also known as trisomy 21, which is where baby has an extra number 21 chromosome; Edwards syndrome, or trisomy 18, and Patau syndrome, which is trisomy 13. And these are the 3 most common chromosome conditions in pregnancy, and NIPT screens for these as standard. Now, depending on which test you have, the NIPT can also screen for things called sex chromosome aneuploidies, so whether baby has too few or too many X or Y chromosomes, and can also test for something called microdeletions. So rather than baby missing whole chromosomes or having extra whole chromosomes, it tests for little bits and fragments of DNA missing from each chromosome. Now, one thing NIPT does not do is look for structural problems in baby. That's the job of the fetal anomaly scan. So NIPT and the fetal anomaly scan are doing completely different things. They both go hand in hand together, and it's important that you have both tests performed. So a lot of questions I have is who gets offered it and when? So this is where it gets a little bit complicated in the UK. Within the UK, in the NHS system, most women are offered something called the combined test in early pregnancy. And this is a test that looks at the fluid behind baby's neck measurement, together with mum's age and some hormone levels in mum's blood. And this gives you a probability of baby being affected by one of the 3 trisomies that I mentioned earlier. So if that risk score comes back above a certain threshold, which we call a high chance result, then the NHS will offer you NIPT as the next step in your screening pathway. So within the NHS setting, NIPT is a second step screening test rather than a primary screening test. Privately, you can have the NIPT from 10 weeks as your first screening test. So this is often before your 12-week scan's even been performed. So you get that information much earlier privately. And the cost privately is typically between about £350 to £500, depending on which provider you choose. So a quick note here, we do offer NIPT at the Pregnancy Experts. It's one of the most common things that people come to us for. So if you'd like to discuss your screening options, have an NIPT performed privately from 10 weeks gestation, and talk through results with a fetal medicine consultant, then the link's in our bio or on our website. Okay, so how accurate is the test? Okay, so for Down syndrome, which is what the test was originally made for, the detection rate is about 99%. And for Edwards and Patau syndrome, slightly less, but in the high 90s. So a very, very good test at detecting babies that are affected by those 3 trisomies. Now, the false positive rate, where the test tells you that there's a problem when there isn't actually a problem, is about 0.1%, so a very low chance of that happening. So what do the results actually look like when you get them back? They'll tell you one of 2 things: low chance or high chance. Not a positive, not a negative, just a chance. And the word chance is deliberate because the test is not diagnostic. It's giving you a chance or a probability of baby being affected by the condition that you're testing for. Now, a low chance result is really reassuring. So most people will get a low chance result if they have the test. And this means that there's an exceedingly low probability of baby being affected by any of the conditions that you've had tested. A high chance result means the risk is elevated. It does not mean that baby has the condition. The next step is that you would be offered an invasive test, so something like an amniocentesis or a CVS, to test whether baby does actually have that condition. And this is where I would want to talk to you in a lot of detail about whether to pursue those tests or not. So a high chance result is not a diagnosis, and I want to be really clear about that. Now, if you have a high chance or high probability result, you'll probably be referred to, or you can refer yourself privately to, a fetal medicine consultant who will discuss the various next steps with you. And this often involves an invasive test. So something called an amniocentesis, which is where we put a needle through your tummy into the water around baby, and we take a small sample of that water. Or a CVS, which is a coronary villus sampling, where we put a needle into the placenta and take a small sample from the placenta and send that off for testing. And that will give us a definitive result as to whether baby does or doesn't have the condition that you had screened for. Now, the reason I'm telling you this is not to make NIPT sound alarming. It's really to make you fully informed of what the result could lead to. So most women would have a low probability result, and that's the end of the screening pathway. However, if you do get a high probability result, I want you to know that the next step will be amniocentesis or CVS. So you're not hearing those words for the first time if you do get a high probability result. You already know that they exist, and you already know what they mean. Well, the question in the title of this video, should I have NIPT? I'll give you my honest answer, and then I'll give you a full explanation. So my honest answer is, in most situations, yes. So a low chance result gives you reassurance at a time when a lot of people are still quietly quite anxious, still waiting for the dating scan to come through, and still waiting to have their combined screening performed. And if the result does come back as high chance, then you've got time on your side. You've got that result much earlier, so you've got time to decide whether you want diagnostic test, you've got time to take in further information, and you've got time to discuss with specialists. Time to make decisions about your pregnancy without feeling rushed. And the people who reasonably choose not to have an NIPT or any screening test for that matter are the ones where actually it would make absolutely no difference to them whether baby did or didn't have a genetic condition. They've already decided how they would approach the pregnancy regardless of what a screening test showed. That's a completely legitimate position to have in pregnancy, and I fully respect that. What I gently push back on is avoiding the test because you're worried about what the result will show. Anxiety about testing pregnancy aren't genuinely a good reason to avoid having tests and avoid finding information that could genuinely help you. So if that's where you are, I think it'd be a really good idea just to have a conversation with your midwife or your fetal medicine consultant just to discuss your screening options and just help you decide as to whether you want to embark on screening tests in pregnancy. And on a more practical note, if you're having your combined test within the NHS at 12 weeks anyway, you might want to think about whether you want to have a earlier, more accurate test at 10 weeks rather than waiting for a high probability result with your combined screen before you're allowed to have NIPT. So NIPT is genuinely a really good test. It's safe, it's early, it's accurate, and for most people, it provides some real reassurance about their pregnancy. Whether you decide to have an NIPT is a completely personal choice, but hopefully this video will give you some information and help you make a decision as to whether it's the right choice for you. If you've got questions about your specific situation, your midwife or fetal medicine specialist is the right person to speak to. That's exactly what they're there for. And if you found this video useful, then share it with somebody who's around 10 weeks pregnant and isn't quite sure what NIPT is yet and whether they should be having it. So next week, I'm going to cover what happens when you're referred to fetal medicine. So a lot of parents find this topic really scary. So I want to demystify exactly what a fetal medicine appointment looks like and what it means. Subscribe so you don't miss it. Look after yourselves, and I'll see you next time.